Hello, everybody. This is Dr. Bob DeMaria with another episode of Ask Dr. Bob from Westlake, Ohio, and join me in Naples, Florida. Dr. Bob, I recently saw you on the Dr. Axe show, and thank you for watching that. It's a wonderful program loaded with a lot of information. And I was talking about flax oil and B6 deficiency. So let me explain to you briefly what goes on. When you eat food, food is a precursor to pathways in the body. Flax happens to be a precursor for the omega-3 fats, long chain, DHA, and EPA. So when you consume, for example, flax, it has to go through steps which require B6, B vitamins, magnesium, and zinc. So we have some people that consume a lot of flax oil. When you consume a lot of flax oil, you're going to use vitamin B6 up. Now, if you're taking the pill, you're going to also have a deficiency in vitamin B6. We determine B6 levels by looking at your liver enzymes on your blood test. I also know, just talking to people and researching it, that flax oil can increase estrogen in your body. So I would vary the oils. You don't want to do one oil exclusively. I would encourage you to do the omega test to find out your omega-3 levels and your omega-6 levels. That will help you a lot. Dr. Bob, I have having a sharp abdominal pain now for months. A recent ultrasound suggested I have quote unquote sludge and gravel in my gallbladder, and he wanted to know what to do. Well, we use something in our practice called phosphatidylcholine. I would encourage you to start using that. That will help emulsify what's going on in your liver gallbladder. But the real key is you have to change your diet. So I talk about this a lot. I eat at least a half a red apple every day. I have beets on my salad. I eat a medium carrot every day. I eat 2 radishes, and I've actually added artichokes. And you say, why do you do that for? Because it supports optimal function in my body. The reason I keep on talking about the medium carrot is those little baby carrots that you buy in the bag, those are actually big carrots that have been whittled down, and then they soak them in the chlorine. So you want to eat an organic medium carrot. That will help your digestion also. Dr. Bob, what causes watery eyes? And you wanted to know what caused it. You didn't think it was an allergy or an infection. And then you wanted to know if there's a holistic way to improve receding gums. Let's go back to the eyes. You probably have a food sensitivity to something. We do the FIT test. It checks 130 foods and additives. If you have a sensitivity to a food in your life or a chemical, your body's going to have a reaction, and it could happen to be in your eyes, watery eyes. You could have watery nose, and or it's very possible you could have a histamine challenge. We use a product to reduce the amount of histamine in your colon. So I would first consider the FIT test. Now, when it comes to receding gums, we use a product from Biotic Research Corporation called Osteo B2. Now, in Dr. Bob's Guide to Prevent Surgery, in the cataract chapter, I talk about calcium and phosphorus metabolism. If you have too much phosphorus in relation to calcium, you're going to erode bone and teeth. So that'd be something for you to investigate. My chapter on cataracts. Dr. Bob, could you explain how to cure a UTI, that's a urinary tract infection, naturally? I would avoid gluten and bread. It's amazing how many women have UTIs because they consume too much bread and or grains. Dr. Bob, I'm writing to you about my 3-year-old. She's spunky, fun, little spitfire, etc., etc. She fell down and she lost 3 of her teeth, and she also had what you called bottle rot. And then you also mentioned that she has a poor diet, and you wanted to know what to do naturally. Well, naturally what you need to do is you need to change her diet. It comes down to that. Now, I'm going to also suggest to you to add at least a half of a medium carrot every day, because I know if you do some research on it, carrots have fluoride in them. I know you don't have fluoride treatment. I don't do fluoride treatment, but I eat a carrot every day. But you're going to want to control what this child's putting in their mouth. We had a dentist in our office yesterday, was talking to Dr. Kaysen, and said people eat too many grains. They do not eat enough raw food, and hence he's seen so many kids with cracked teeth and so many fillings today, more than you could ever imagine. I'm Dr. Bob DeMaria.